Hey guys, this is Dr. Jamie LaViola with Dental Masters of Alexandria, and today we're going to do a little bit of a deep dive on dental facial aesthetics. So what's that mean? Well, when you come in to have your teeth worked on or to have your smile redone, there's a lot more things that have to be taken into consideration than just teeth. There is soft tissue, there is the position of your jaw, there is, are you missing teeth and you have missing bone? So anyways, there's a lot of different issues. We'll go ahead and jump in, start talking about some of these topics and how they are important for you to think about and discuss with your dental provider. And by the way, typically when we're working on a case of this magnitude, and we call this very often interdisciplinary care, where there's multiple providers. Maybe there's a restorative dentist like myself. I'm a surgeon as well, but there's also an oral surgeon, oral maxillofacial surgeon that may be doing jaw surgery. There could be a plastic surgeon, an ENT. So it's important that one person's the quarterback, meaning that they are really directing what the final result must look like. And a lot of times the quarterback is also talking to the other doctors to get their feedback on some of the things that their specialties are more prevalent. So let's go ahead and get started. So soft tissue. One of the things that we see with soft tissue, number one, is if you start to lose teeth, we'll talk about the teeth portion of this, and you wear dentures, then you're going to start to get what's called like a sunken face appearance. And as you can see in these pictures here, the more time that you wear dentures, the more that your lower jaw jets out and your upper jaw looks deficient, your lips start to cave and the soft tissue starts to sink. And it can drastically age you. You could look 10 years older with dentures and having worn dentures for even as little as 3 to 5 years. That's why we talk about dentures really being, for the most part, a temporary solution to get you to transition to more permanent solution with implants. But also just 1 or 2 missing teeth actually can affect the symmetry of your lip. If you're missing teeth over here, you start to also lose bone and soft tissue, which supports the lip. And this somewhat depends on the thickness of your lips and so on. So if you have thinner lips, you're gonna see that more, and you may start to get asymmetrical lip. So that's kind of how the teeth play into soft tissue, but let's talk about some other things. A lot of times people have thinner lips and they may want to use lip fillers or they want to remove some wrinkles with Botox. It's really important that you talk to your quarterback, your dental provider, about that, because I don't want to design a smile if I don't know if you're going to use lip fillers or have a lip transplant with a plastic surgeon, or if you're using Botox, because Botox actually will affect how much your lip goes up. Some people have what's called a hypermobile lip, where the lip just climbs up more than it should and you show a lot of gum. We've talked about that in another video called the gummy smile. In fact, you can click on this video here if you want to see it. Hey everyone, welcome to another episode of Ask Dr. J, and today we're going to talk about the gummy smile. What does that mean? That's when you smile, you display more pink than white. So again, Botox can be used for this treatment of hypermobile lip, but also it reduces how much your lip goes up. So if we're planning a smile and your intent was to reduce some wrinkles and you haven't spoken to your dentist or your quarterback, so to speak, about it, it's a real issue. So communication is also key about this. So I know that information was a lot more technical than we normally go, and a much deeper dive, as I said before, but I think it's really important that my audience gets the appropriate information, no matter how technical, and whatever is necessary, so that you can make the best decisions for yourself, health-wise, or your loved ones. So if this is information that can help another person, please feel free to share it. Go ahead and like and subscribe if you enjoy the information, and at the end of the day, we really just want you to have a phenomenal smile.